patients are responsible for a greater and greater share of their care. How do you see this evolving? Is this a good thing? And long term, how do you think this is going to play out?
Well, anything to the extremes, can cause problems. But the extreme is that in the 60s and the 70s and 80s and 90s, that most people would negotiate if they were with a negotiating team to have the companies pay all of the dollar one coverage, we used to call it, first dollar coverage. And as a result of that, the patient had no skin in the game. So no reason to check whether or not the treatment was good, bad, or whether or not. If the doctor says, well, you really don't need it, and the patient says, well, the company, Chrysler, is paying for it, so let's do it. And so there was a lot of duplication, a lot of overuse of the thing. And with patients paying more of it, you're going to see right now that patients are going to be much more cautious and much better buyer of healthcare, which I always believe is good. And they're going to become much more learned about their diseases. It's amazing to me right now, Mark, and you know this as well as I do, that anybody that has any kind of a disease, the doctor tells them whatever the thing is, what is the first thing they do? They go home and get on the computer, and they look up on the computer exactly what it is about. And they're able to come back and tell the doctor something new about them and about the disease. So that right now, America, with the computers and with the fact that they have to be more involved, are becoming much more educated on their own body, their own diseases, and also how the system works. That is very much a positive.